Epilepsy is more common than many people realize, but there is confusion about what it is, what it looks like in real life, and how it's treated. I'm here today with a leading epilepsy expert, Dr. Blanca Vazquez. She treats patients and researches new epilepsy medication at the Comprehensive Epilepsy Center at New York University Langone Medical Center. Welcome, Dr. Vazquez. Tell us what epilepsy is and what happens when someone has a seizure.
Epilepsy is a chronic medical condition characterized by recurrent seizures. It's an electrical storm, and it can be manifested by a convulsion, which is the most dramatic seizure, or it could be a simple stare, which is an absence. There are partial seizures and there are generalized seizures. It is key to understanding epilepsy and treatment to see exactly what type of epilepsy the patient has.
How does epilepsy uniquely affect women?
Women have to live their life. Their lifestyle can affect their epilepsy. It is unique because the menstrual cycles and the hormones can affect the seizures. It is also unique for women because the reproductive age, from the beginning, how to prevent pregnancy, to conception, pregnancy and breastfeeding. It's also about menopause. It is really across the reproductive years, in a young girl that gets diagnosed to a woman of childbearing years. And it's very important that you become very familiar with this unique aspect of women and epilepsy management so you can ask the right question to your doctors.
That is an important goal, Dr. Vazquez. How is epilepsy diagnosed and treated?
So the type of epilepsy will determine the treatment. The diagnosis is made, it's like a puzzle. It's the imaging with the MRI, a picture of the brain. It's about what happened that started the epilepsy, and all put together with other studies like electrical studies of the brain can give us a whole picture. Is it partial epilepsy or is it generalized epilepsy? And when someone has partial epilepsy, the medicines are different than when they have generalized epilepsy. So the treatment is using anti-epileptic drugs, we call them AEDs, or using surgery or vagal nerve stimulators. 50% of the patient will stay with the first medication they started to treat the seizures. So the key when selecting the first medication is to look at the future, preventing chronic problems, preventing future side effects that we don't see now, but it can get you in trouble. As a woman, you must partner with your doctor. You need to look a lot of the information. So there are good websites like the epilepsyadvocate.com or healthywomen.org, and that you can get a lot of information there.
That's really great information. How many people have epilepsy in the United States?
In the United States, about 3 million people. It's as common as breast cancer. 1 out of 3 women knows someone that has epilepsy. It is really no different between men and women. The incidence is about the same.
From a medical perspective, how does epilepsy uniquely affect women?
The reproductive years are very important. Women with epilepsy have to really balance the life. It's about their runaround. It's about lifestyle modifiers like you need to sleep 8 to 10 hours. It's very important to prevent seizures. You need to remember to take your medicine in your runaround. But epilepsy, physiologically, speaking of what difference a woman from a man, you have to look at the hormonal cycles, the preparation for pregnancy, breastfeeding, menopause, osteoporosis. Some anti-epileptic medications can put you at risk of having weakened bones. So all those things are very unique for women with epilepsy.
Let's shift gears for a second. You're a mom living a day-to-day life. How do moms with children and families deal with epilepsy?
It's all about that famous balance. It's really your lifestyle, and how does that affect your medical condition? As a woman, you manage your family life, and you have to manage your condition as well. Empowerment, knowing what to ask, being educated for the different stages of your reproductive life, for the things that you may not be aware. Is sleep important? Is alcohol important? Do we have any relationship with stress? What about mood? So women really juggle a very different aspect of life and definitely can be directly related to how well the epilepsy is controlled.
It's so encouraging to hear that people can live well with epilepsy. Can you tell me a little bit more about some of the new medical treatment options that make this possible?
We're living a very important life in epilepsy. We've had many new anti-epileptic drugs in the past decade. The new options of treatment not only work towards stopping seizures, but to improving the quality of life of women with epilepsy. We're talking less interaction with hormones. We're talking preventing osteoporosis. Older medicines had that side effect. We're also talking about mood. Patients with epilepsy don't want to be depressed, and there is a great relationship between mood and epilepsy. So the new anti-epileptic drugs have a profile that is more favorable for a regular life, managing the kids, getting the kids out of the house in the morning, all the things that we have to do, work, concentration. If a woman is going to college, she needs to be able to learn. And there are some medications that can make you a little bit more tired, a little bit more slow. So you need to partner with your doctor. You must ask questions.
Such great advice. What else do we need to know about seeking care for epilepsy?
Comprehensive care is very important. It's not just about seizures and medicine side effects. It's about preventing unwanted pregnancies. It's about getting pregnant when you want. It's about living a normal life. It's mood. It's all the things we talked about. So ask for a second opinion. If you feel that your questions are not answered, if you feel that your side effects are not acceptable, ask your doctor, can we change? I'm not willing to settle. Talk to your doctor is so important.
Thank you, Dr. Vazquez. Now we'll meet two women who are well on their way to achieving their goals. Joining us are Heather and Shelley. Both generously agreed to share their personal stories about how they successfully navigated the challenges posed by epilepsy.